Good afternoon, ladies and gents. Welcome to this breakout session of the second MAP Next Gen CEO Web Conference 2021. I am John Allen VINTA, President and CEO of Micromatic Industries, your moderator for this breakout session on the good tech. This is the first session of track number 4. Track number 4 is all about the good tech. Please settle down comfortably. We will now begin our program. Some reminders before we proceed. As participants for this breakout session, you are automatically muted and your camera or video is also switched off. Audience in the EcoHub platform will remain muted. However, you are encouraged to submit your questions through the chat box. Due to time limitations, we may not be able to have all your questions answered live. Lastly, for our audience, you will only be able to see the speaker and the moderator and will not be able to view the other participants. In line with MAP policy, we will dispense with the lengthy introduction of our speaker. Our speaker for this breakout session is expected to share with us his views on how next-gen CEOs in his or her industry or sector should lead their businesses to be innovatively profitable, socially responsible, and environmentally respectful. I would like to remind our speaker that you are given 20 minutes for your presentation. May I now call on our speaker for this breakout session on the good tech. Please welcome one of 2020 Asia's top 100 scientists by the Asian Scientist magazine, the founder and CEO of Manila Healthtek, Dr. RAUL V. DESTURA.
Good day, everyone. I would like to thank the Management Association of the Philippines for inviting me today to speak in front of STEAM colleagues in this webinar. I was asked to talk about our journey and our experience on our biotechnology programs from a small work coming from the university and to where it is today as the first health biotechnology company in the Philippines. Our driver is actually asking the question, what if we can actually make molecular diagnostic technology more accessible here in the Philippines, because we're going to do it here instead of bring it into the country? Because diseases of poverty are mostly driven by infectious diseases. So access to low-cost technologies for its control is very important, and at the same time create that mechanism wherein your group, your organization actually generates new knowledge to find sustainable and equitable solutions to diseases of poverty. But an idea will just remain an idea unless you execute them. So allow me to share with you our journey about this idea that we actually put together, and where it went, its journey, what happened to the idea, and where the idea is heading. Building a biotechnology company in the Philippines uh, is a very daunting task. But sometimes, if you really want things to happen, because you really want things to happen, there must be that willingness to take bold risks, to the point of being fearless, or even brave, or having that grit, knowing that there are no health biotechnology company in the country, and that you're gonna go through the whole process and most likely stumble several times along the way. Um, in terms of developing diagnostic technology for healthcare intervention, we feel that it all starts with needs assessment. And that particular time, a point in time when we were discussing our ideas, the thing that really come to our minds is access to one of the most powerful diagnostic technology for diseases already being enjoyed by developed countries but only accessed by less than 1% of the Philippine population because of the limiting cost of such technology. Therefore, ideas are generated out of need, and not the other way around. So, where did this idea took us? Us to create several targets and platforms from funding coming from the national government's Department of Science and Technology, and intramural coming from the university, where we're able to focus technologies for vector-borne diseases like dengue and chikungunya, tuberculosis, multi-drug resistance organism, HIV drug resistance profiling, influenza, neglected tropical disease, and waterborne parasites. It became an adapted flagship program for communicable diseases of the Philippine Genome Center and the NIMBB of the UP National Institutes of Health in 2009. These adaptations for a program at the Philippine Genome Center and UP Manila created the Lab in a Mug project. The Lab in a Mug projects wherein we sort of miniaturize an isothermal technology that doesn't require any more expensive equipment to be able to access molecular-based diagnostic testing. So this Labinamag is a multi-infectious disease diagnostic platform that is actually 90% cheaper than the current molecular machines for amplification. And our flagship program at the time was focused on dengue. It became an internationally recognized product, became a gold medalist in the 46th International Invention Exhibition in Geneva in 2018, and passed evaluation by the ASEAN NDI panel of experts in 2019, wherein out of 38 technologies being forwarded by scientists in all ASEAN countries, two made it to become an internationally endorsed product line, one coming from Indonesia and the other one coming from the Philippines, which is our dengue technology. But in spite of all this, we wanted to be able to bring this to the target end user. We're good in developing research, technologies, competitions, which technology is better or that. But the business side of biotechnology development is is the biggest gap now here in the Philippines. It was a challenge, and we have to again talk among ourselves as scientists and decide, are we going to go for this or not? At that point in time, there were no company willing to take a chance. There were no expertise in diagnostic kit manufacturing in the country. There was limited knowledge in technology commercialization from bench to bedside. There were limitations in the number of scientists skilled in the art of both the science and the art of entrepreneurship. But we really wanted our technology to be able to reach our target end user, which are countrymen or the Philippines. So we decided maybe we should just do it ourselves. So it was a decision wherein, are we going to do a startup wherein we'll fork it out, brave the storm? Or are we going to ask an industrial partner to buy out the intellectual property and us move it together into a company which we call a spin out? Or is it something that we can use both the help of the university and an industrial partner or friends, neighbors, family members who are willing to provide some investment money to start the ball rolling? So we pursued the spin-off idea, principally because there were a lot of things that happened that kind of supported it along the way. One is the Tech Transfer Act of 2009, because some of the problems why professors and researchers in the universities are also not that willing to to commercialize their product by themselves is because they will be forced to leave the university. But we really love, it's, I know it's weird for most people, but we love teaching, we love molding minds, but we also want to make sure that our technology, some of us, reach the other side. So the best thing about it is we kind of, although we're a little bit late, but in the US, in Europe, professors are actually counted, measured in terms of their career academic growth, not just by the number of publications they produce, but also the number of spin-offs that they can actually create based on their fundamental scientific findings and work. So the Tech Transfer Act of 2009, we studied them and say maybe we should give it a try. In March of 2016, it was approved by the Board of Regents of the University of the Philippines to license the technology to the spin-off coming from the core scientists that developed the technologies from the University of the Philippines. Since the birth of the first university spin-off company of the University of the Philippines, which is really to develop and scale up affordable molecular-based diagnostic kits for both communicable and non-communicable diseases. Our company has four major technology pillars, and the first three, diagnostic, isothermal, and PCR technologies, became our principal activities in the initial development processes of the company. Making a company is one thing, making it sustainable is another. So because when we were going through regulatory and all of these things, this is the first time that these agencies are actually receiving requests for approvals and regulatory consent work, which actually they're used to foreign technologies coming in. So we became like guinea pigs every step of the way. We officially launched the company in 2015. We became an FDA approved facility for research and development, and also a special lab for clinical molecular services. In 2016, we got the FDA approval as the first manufacturing company for molecular diagnostic kits. Also, an FDA approval for our dengue detection technology and nucleic acid technology. And we were given Outstanding Technology Award by the National Academy of Science on our dengue detection technology, and that the tech transfer of all the technologies we developed were licensed to us from the University of the Philippines. Then in 2017, in order for us to maintain our sustainability, we provided services for cancer diagnostics for AstraZeneca and Boehringer Ingelheim. And at that time, the Department of Science and Technology released the Fairness Opinion Report, allowing the company to transact with government agencies. We're so excited that finally the Department of Health will be launching the pilot implementation program of our dengue kit, and we will be able to shift from manual to robotic-based manufacturing. Unfortunately, while in that process, the Dengvaxia controversy came, and all programs that has the word dengue on it kind of took a slow turn. And to make the long story and dramatic story short, the program got halted and became the 2018 as the most challenging year for our company, because we were working on the dengue technology while we are developing other technologies in the process. But we had to diversify, increase our technology portfolio, develop new technologies. So I guess in the midst of pressure, you tend to be more creative because you do not want to go home failing. So in 2019, the largest dengue epidemic in the country was observed, and hence there was the resumption of the dengue implementation program, and we were able to expand further absorptive capacity to convert manual to robotic based manufacturing. And at that time, because of all these technology development portfolios that we will put together, we were now independently valued as an 800 million company based on our intellectual properties. So basically, we didn't realize that all of these things that happened to us over the last several years kind of gave us a preparations for what it is to come. So while we thought we're working on dengue epidemics, a much bigger and deadlier epidemic were actually coming in and brewing in the horizon. And towards the end of 2019, again, a news of a novel coronavirus was actually identified in Wuhan, China. And then COVID came to the Philippines in the first quarter of 2020, again affecting the dengue programs that we have been pushing forward. But then we realized what else is new, everything is a challenge, so we just have to keep on going and pushing for building a stronger biotech programs within the organization in order for us to be able to get there. So little did we know that our challenges with the development of the first COVID-19 locally developed COVID-19 technology became our turning point as a company. And because of that, we were able to move things forward and learn a lot from this pandemic. And this is our COVID-19 story. In December of 2019, a novel virus first identified in Wuhan, China, is spread like wildfire around the globe. Like most countries, the Philippines were also cut off from the global lockdowns, affecting not only access to global goods and services, but as well as access to diagnostic technologies that is crucial for case identification, monitoring, and surveillance. As the world scrambled for the ability to be able to test individuals, so as the limitations to access diagnostic technology, particularly the RT-PCR. As the global community tried to accelerate testing, supplies became a challenge, especially among countries with limited resources. As per law of supply and demand, the cost of the testing at the start of the pandemic ranged from 80 to 200 US dollar in the Philippines. And the only way we believe for us to change that is through local innovation. I remember sending this message to my research and development team on the development of a PCR-based assay based on the genetic sequence published at the early part of the pandemic, and that's how we started the ball rolling. As we were brainstorming our ideas, we wanted the diagnostic technology to be sensitive enough to be able to identify the disease at the early phase of symptoms. It must be specific enough to make sure that it readily identifies the virus and not something else. That the process of the laboratory performance should be shorter because of the time element of the diagnostic testing required to most number of people. It must be able to identify multiple targets at the same time to better appreciate the sensitivity and specificity of the technology. It must be able to confirm the diagnosis with certainty, and most importantly, it must be affordable enough for my countrymen. After several weeks of research and development, the Gen Amplify Coronavirus Disease 2019 RRT-PCR detection kit was developed. This is a one-step multiplex PCR platform that detects three genes of interest: the E gene, the RDRP gene, and the human endogenous sample control, the RNase-P. It can detect COVID-19 virus as low as 0.05 copies per microliter 100% of the time with 100% specificity. It generated a 91 to 100% concordance rate compared with foreign PCR technologies that were tested by independent laboratories in the Philippines. But the most important thing is from 80 US dollar, we were able to reduce the cost to 8 US dollar. How did we come up with the cheapest COVID-19 RRT-PCR kit in the Philippines? In the Philippines, we have the Bayanihan spirit. Bayanihan literally means being in a bayan, and it refers to a fundamental aspect of Filipino culture working together as a community to achieve a common goal. Through a government, academe, and industrial partnerships, we were able to put all our resources together to come up with the cheapest technology that can be provided to the Filipino people. As early developers of the technology, the company and my team were placed on the global stage. To date, close to 400,000 patients were tested using the locally developed technology. And our post-marketing surveillance provides our client-based satisfaction rating of 9 to 9.4 over 10. More importantly, the diagnostic kit maintained its ability to pick up the circulating variants, including the Delta variant. Because of the local support, the generations of technology went beyond the development of the COVID-19 kit here in the Philippines. It generated over 160 new jobs for Filipinos and at the same time generated an additional 52 technologies coming from the outputs of our research scientists in the company. So where are we heading after all of these challenging moments and successes in terms of developing technologies for the country? I think we just have to keep on going in terms of our plans for the future of the Filipino scientists and providing them an area, a space, a haven wherein they can actually do what they do best, their creativity and knack for developing scientific technologies that will help improve the lives of our countrymen and at the same time become a future contributor of the country's macroeconomic growth. Of course, it's very important that in looking at the future directions of the company, the first step towards getting somewhere is actually decide that we are not going to stay where we are at the moment. Hence, we decided to move on to the next level, which is this one. So in the future, the next couple of in the not so distant future, we will give it our best to improve and build the health biotechnology ecosystem here in the Philippines. Simply because, as the founder and CEO of the first biotechnology company here, I feel that it's also our mission as a team, to try to make a statement that Filipino scientists is at par or even better than some of the companies outside the country, and that we can compete at the global stage, but we need to do our homework and make sure that we build that ecosystem that will make sure that the programs and the exchange of ideas and the opportunities for collaborations are here. But beyond just by building scientific work and bring them all the way to the marginalized sector or to the society here in the Philippines, it's simply because as Filipinos, it should not be asked from us to serve and love our country. It should be freely given by ourselves to make sure that the future of our children and our children's children will be way better than the current situations we are in. And it's not just an obligation of one sector of society, but should be a collective spirit of all of us who needs to make sure that we are building this not just for profits, not just for, inner gains, but we are building it on a much higher purpose because we want something that will make everyone's lives better. And hey, in the process of doing that, it's it's the company is growing and providing opportunities for financial growth among its members. The world as I see it is beautiful. For me, it is beautiful. Despite of everything that's happening here, I still look at the world as one of the most beautiful sight to see. No, we must all contribute to use our knowledge in making it better, not just for ourselves, but for every living thing that makes it wonderful. That we must be more active in showing love for country, that we must strive to find meaning in what we do, and that whatever path we choose them because it's what makes us complete. So I always tell my team every time we start developing new technology to have a dream, to start somewhere, and persevere. Thank you so much for having me today. Our next step is helping the country's effort in controlling the African swine fever epidemic. We just got our FDA approval and we're doing the daily grind again. Thank you so much and have a wonderful day.
Thank you, Dr. Raul. What an interesting presentation. Your Love in a Mug project paved the way for low cost diagnostic testing that developing countries like us really needs. Also, what's equally impressive was you became the first manufacturing company in the country for molecular diagnostic kits. By the way, happy anniversary to Manila Healthtek, sir.
Today.
Yeah, today I heard you celebrated your anniversary. Happy anniversary.
Yeah.
Yeah, to start with, I have some questions of mine. As a next gen leader, you mentioned you need to be bold, fearless, or brave. What are the stumbling blocks you had experienced in your field?
The stumbling block is really cultural. We still have that notion. We can't blame most of our culture. It's really that imported are always better than local. Um, that's one. Second is our processes here is not as efficient as in other developed countries in terms of business processes and transactions. Third is our regulatory standards here are still not at par with what's actually required in the global community. So what we usually do is we also seek accreditation in the international arena to make our product not just only in country relevant but regionally relevant. And of course, if we can have less of bureaucratic steps, that would be better. So these were all of our stumbling blocks. And of course, when resources or raw materials are coming in from outside the country, the processes of bringing them in is also a bit of a challenge. Can really test your patience.
Yeah. So mga same challenges for other companies na Filipino-owned companies. I'm
Yeah,
about to ask that, like, challenges for locally developed products today versus developed brands. So I think you answered my question on that part. So it's really difficult for us Filipinos. No, you're right. Actually, it's culture. Yeah, it's culture. We love, or we depend on imported products. Even with the
yeah,
vaccine, we prefer brands rather than the quality of the product, right?
that's true.
You mentioned you need to balance your profit on or business. Can you share us how you do it in your organization?
In our organizations, we also, um, I, as I mentioned in my closing statement in our anniversary celebration, our greatest asset really are our people, the creativity of everybody. So sometimes, based on experience, there's so many factors affecting human creativity, and sometimes it's the one that's actually missed out, no, by most of us, no, because we are focused on P&Ls and all the others, no. But in case, so that's why in how do we balance it? We consider supporting our human resource as important as generating tangible profits. We consider creativity as also profits, in this case, because if you are a research and development company, the ability to innovate, be always inspired, requires that particular type of thinking. So that's why we have, as important as the chief financial officer or the chief marketing sales or chief operations, it's at the same level to have a chief wellness officer for our human resource, because having that kind of treatment to our scientists, uh, gives them not just encouragement but also a form of meritocracy, to the entire organization. And that's, once the creativity of your team dies, the entire biotech company would definitely die or lose its relevance. So that's how I balance it. Sometimes, we're asking how can we give back more to our team, uh, that will continue encourage them, inspire them to create new things. And that's the model, so far it's working right now, from one product to 54 products in
Wow.
16 months. Yeah.
Oh, good to hear. So
Yeah.
it's also the same with work-life balance with your employees, I assume.
Yes. Yes. They need to play. They
Yeah.
have to play.
So
Otherwise,
you're
yeah.
both aligned. You're aligned. So
Yes. Yeah.
what's your
Right.
vision and the vision of your employees?
Yeah. Our offices has sugar corners and ping pong tables and all of these things. Just so, video games if
Wow,
they want to.
malagugel.
I don't want them to sit on the bench, a table, 8 to 5, and clock work only, or body clock human resource management. I'm more concerned about their outputs. If they can be more 200 times creative elsewhere, I will let them go there. So,
Okay.
I measure them based on their outputs.
I heard you talk about meritocracy. So how do
Yeah.
you do that to help uplift naman yung the weaker part of the organization? Di ba, syempre,
Um, yeah. So it's a very challenging human resource management framework if you're working with eccentric people, because they are all scientists, and
yes, yes,
the
yes.
EQ levels are a little bit in
I
different
can't
degree.
imagine how you, ano, because iba-iba
Yeah,
yung, probably you have different mindsets, right?
yeah. And sometimes the reason why they are not productive is because you put them in the wrong track, and they are unable to bring out their creativity, not because they are lazy. So human engagement and assessing the internal workings of a scientist mind needs to be assessed by our human resource department and our psychology, psychiatry group, no? That allows us to make it, understand more how we can actually provide opportunities for this person to bloom, in this area. It's a challenge. It's more personalized. But I think
Yes.
uh, if we spend more time on other strategies, creating marketing personas, looking at our P&Ls and all of these things, same energy must also be given to the inner workings of the mind of scientists in an organization wherein creativity is the commodity rather than a requirement.
Wow. So probably nga, iba yung thinking pag most scientists, you're working with most of the scientists in the Philippines, right?
I've been working with
So
them for like 30 years, so it's
yeah, 30 years. Wow, that's so long. So when I talk about with our friend with my friends in the medical industry, when I say your name, they'll tell me that you're one of your ano is the dengue testing equipment.
yeah,
So
yeah.
after all this, even with the COVID, with the dengue, with your biotech lab, uh, what do you want the world to know you?
Well, I just want to be known as the person that democratized access of one of the most amazing diagnostic technology that used to be accessed only by people who are up there. But now I want to democratize this and make it more available to the marginalized sector, and yet spawn profitability. And that's how we built our company right now. But of course, there were a lot of near misses,
Yes,
wrong turns and left. But we took it all in as part of our learning process until we get
it's
the final groove that works for us.
I think it's part of the growing pains
Yeah,
of
that's
every
the
company.
growing thing.
Yeah.
Yeah.
But like with your presentation of the future of Manila Health, I see your future brighter. So
Thank you.
again, thank you, Dr. Raul, for sharing your time and expertise with us today. Good luck on your future endeavors. While you're doing is a big help to our country's health system, not just for our health system, but for us, for the Filipinos, providing low cost technology that could help us rather than be dependent on imported ones. Again, thank you, everyone, and stay safe and healthy. Please log in now for the next breakout session of your choice. This breakout session is now adjourned.